What if a method existed to eliminate the leading cause of preventable disease within the United States? How about if this same method would prevent almost 500,000 deaths a year in America, many of these deaths being premature? What if this method would save the United States billions of dollars in healthcare? Would America use it? How about if this method significantly reduced the death of babies from sudden infant death syndrome and prevented children from developing debilitating and life-threatening diseases? Would these reasons be substantial enough for the nation to utilize this method? Well, this method does exist. The question is, will the United States Congress approve the policy? My name is Angelique Gopar, and I'm here to discuss why we need to implement a nationwide smoking ban and the impact it has on healthcare and the country. The Congress of the United States has never instituted a nationwide smoking ban, and only 28 states have implemented smoking bans that outlaw cigarette use in workplaces and public areas. However, smoking cigarettes is still the leading cause of preventable disability, disease, and death in America. 1 in 5 deaths in the United States is caused by smoking or secondhand smoke exposure. 36.5 million adults in America are estimated to smoke cigarettes. 16 million Americans have a disease related to smoking. Almost 5 million students in middle school and high school admit to using at least one product containing tobacco. Death from lung cancer, heart disease, or stroke are among the most common causes of smoking. However, cigarettes affect the whole body, and these diseases cause premature death, which can mask other diseases that result from smoking, such as Alzheimer's disease. It is not enough to avoid smoking to prevent these life-debilitating and threatening diseases, because bystanders from secondhand smoke are also at risk. Children with asthma experience attacks more severely and more frequently when exposed to cigarette smoke. In addition, children exposed to secondhand smoke are at greater risk for developing ear infections, respiratory infections, and dying from sudden infant death syndrome. Also, females are at risk for giving birth to a newborn with a debilitating defect from being exposed to secondhand smoke before they even become pregnant. So by the time they are pregnant, it may be too late for them to avoid the risks of secondhand smoke on their unborn child. Lastly, cigarette smoke is costing the United States billions of dollars. Each year, healthcare costs hit $300 billion to treat illnesses related to cigarette smoking. Implementing a nationwide smoking ban may seem like a tough feat at first. However, it is recommended to take small steps and model a policy after states such as Massachusetts, who have established smoking bans. By first implementing workplace smoking bans nationwide, the rate of starting smoking cigarettes will decrease. Hospitals should not permit any amount of the space near the hospital for employees or patients to smoke. Also, there should be a ban on smoking breaks for employees because they can smoke and bring back remnants of the cigarette that can exacerbate the patient's existing conditions, whether it be respiratory, cardiac. Public places such as bars and restaurants and parks should then have smoking bans put in place to increase cessation of smoking, as well as decrease the exposure of the bystanders to secondhand smoke. Smoking laws must be controlled nationwide to prevent the youth of America from beginning to smoke. It is recommended to not only implement school and youth-related hangout spots such as malls and fields smoking bans, but to also increase tax rates on cigarettes and tobacco-related products for the best success. Other areas where there's a high smoking rate is in the homeless population. And research has shown that smoking bans should be implemented in homeless shelters to lower the incidence of smoking in this population. With expanding no smoking bans in public areas, raising taxes on tobacco products, the United States Congress can work towards establishing a nationwide smoking ban.